Okay, guys. So today I'm gonna especially address the issue of exercising with lower back pain. Most of us who have experienced lower back pain, who are dealing with it right now, they think that it's a lower back problem and they've really stopped moving. They've stopped lifting weights. They've stopped exercising in general because they think that will aggravate their pain and they will suffer more. Which is not the correct way to go about it, because lower back pain is not generally because there is something in the lower back. If it's a genuine disc issue, if it's a genuine injury you've had in the disc or in somewhere in the lower back tissue, then it's a lower back problem. Most often than not, it's your tight hips because of moving improperly, sitting a lot, and not exercising the way your body should exercise. So let's address it in three phases. Let's understand where the problem is. If you have a general lower back pain, which usually is a pinch over the hips, could be usually on either side or could be on both the sides. Mind you, this, if not addressed in the initial phase, probably a month or so, the fascia, because of you're not moving, that pain is already there. The body makes more fascia, it develops more fascia on top of it. So what happens is, now even if you want to move, it will be more pain because you have rigidity all over it. So when there's general pain, if you don't move or don't address it, then there is major problem. I'm going to address it in the later phases. So in this general pain, this could be usually due to sitting, due to posture, due to of course I've spoken about this in the earlier in my posts as well. The Yonda's lower cross syndrome, where you have a huge arch in the lower back and a huge bulge in the belly like this. It sort of looks like a Donald Duck posture. It kind of, if I'm addressing it, second one is that pain could be due to injury. So injury could be due to disc, of course, very common, due to some bad fall, some bad accident. People have had disc issues, disc rupture, or hip replacement, hip rupture. Could be anything, bone getting off. So in that first has to heal. Okay, that bone has to come in place, and then what generally people do, they don't move because they think that will come off again. It does not happen. Yes, the body creates fascia over it just to protect it. Fascia is a tissue; it protects it. But then if you don't move, it becomes rigid. And if you try to move, it will not move. So what happens is, you will compensate. For example, if you have disc issues, you have fascia all over here. If you try to compensate and your hips are weak and your quads are also weak, your hamstrings are really not firing, all that load goes either ways. It could go to the knees, down to the ankles. It's a chain of pain that happens, and then you don't know what's happening. And mostly the physios also don't know what to do. Then they prescribe all sorts of therapies, all sorts of yoga, all sorts of stretching, I don't know what. Yes, so rigidity, loss of range of motion, of course. Most important thing in everything, every pain, every injury, every localized pain, you must never compromise on the range of motion. I'm going to address this particular topic in a separate video. It's a very big topic. If you're doing a push-up, if you're going halfway, which most people do and they count it as a push-up, which is bullshit. So if you're doing it this way, your body has created fascia in that partial range of motion. If I ask you to do a full push-up, you're going to be stuck here. I've seen people, bulky, muscular people, couldn't go full range of motion in either of the exercises. Squat, push-up, lunge, fundamental exercises. If you're able to do fundamental exercises properly with full range of motion, it's a shame. So You know what I imply, right? So exactly. So the next phase is, what do we do about it? Fundamental movements. In all my videos, I speak about fundamental movements: push up, inverted row, push, pull, squat, lunge, hinge. Always, always, always with full range of motion. So in this issue with the lower back, we are just addressing the two lower body fundamental movements of squat and lunge. With lower back pain, if you try and squat, so first of all, you don't know what the issue is, and if you try and squat, mostly you're gonna be able to squat up till probably 1/4, maximum half with pain or a bit of pain, and then you're gonna come up. Again, what you're doing is developing fascia on the partial range of motion. The moment I ask you to go deeper, you're gonna break something. It's gonna be the load is going to shift towards knees, towards upper back. You don't know where it goes. Restore full range of motion. Secondly, release or loosen. Foam rolling, trigger point therapy, tennis ball, all that comes here. You have to loosen that fascia, let the bone move, let the muscle move to the full range of motion. And then finally strengthen it, load it. Once that range of motion is there, you have achieved it, load it. Make it stronger so that pain, that root cause of that pain goes off, because you're strengthening the right areas. For example, if it's a lower back pain, localized lower back pain without injury, general, then there's a problem with the core, there's a problem with the hips. You strengthen the hips and the core, the lower back pain goes away. How to do it? As I spoke, 3 areas, major areas. Hips is the most important, the hip complex, hip flexors, hips, the upper hamstrings as well. Core, most important. People who are suffering with the lower cross syndrome have to train the core smartly, not hard, very smart. Anti-attack movements, sometimes weighted abs as well to strengthen it. Upper back, because everything is connected. The spine, the lower back has a huge arch, upper back will also have a huge arch. The posture, final posture is going to be like this. So strengthen it. Strengthen the thoracic, strengthen the hips, make the spine neutral. You have to make it straight. This is what it is. Try and make it this. Obviously it's not going to be exactly straight, but it's almost going to be in the neutral range. So with general pain, we assess the posture first. If you see, do you have the lower cross syndrome? Do you really have a bulge in the lower belly and a huge arch in the lower back? Before exercising, start incorporating the SMR, self-myofascial release, or the foam rolling or stretching in your warm-ups, so that before you lift, you have actively loosened the tight fascia on those pain areas. SMR, of course. Now, I have actually addressed this in another post, that Donald Duck posture, what has to be released. The major issue is your hip flexor, because you've been sitting a lot and not moving properly. So your hip flexors are tight, and the hip flexors join right from the upper thigh to the back of the spine. So when those become short, you tend to be crouched. This is your comfortable position, this is your uncomfortable position. So if you try and stand, the hip flexors are released, so they are very tight, they try to pull you, and because of that, the posture becomes like a downward. Okay, stretch your hip flexors, stretch your hips, 3-way stretch on the bench. I've shown a lot of stretches in my posts. And of course, when you're strength training, do full range of motion. No matter what, no matter if you have to use just 1 kg and don't have to use any weight, do full range of motion in the squat, in the lunge, in all these exercises that you're doing, in the push-up. Everything has to be full range of motion with focus on the neutral spine, with deep breathing in between sets, box breathing, cadence, so many breathing techniques where you hold your breath, where you actively exhale and feel your core being worked. Everything has to be there. If it's an injury or a disc issue or hip replacement, hip tissue damage, then rigid fascia, which is developed on top of that, on top of the damaged tissue because of the healing property of the body, is developed. And because of that, it facilitates poor movement, because when there is tight fascia, it won't let you move past a certain range of motion, because it is very tight and there's going to be overcompensation. So you have to release it here. And then on top of that, we sit a lot because we are injured. So hey, pity me, I have to sit a lot. I'm going to damage myself like that. So don't do this. Instead, loosen it through self-myofascial release. If you really think that it's a pain to get a foam roller or tennis ball, then it's best if you stay in pain and let that pain aggravate to the other areas, and you feel like shit, and if you're okay with that, then don't buy it. It's a premium investment, prime investment for you, for your health, for your well-being, and I insist, if you could get at least one tennis ball and a foam roller, or probably a medicine ball you could gut smash it with, you'll feel a lot of relief with that. Activate stabilizers. Now, what happens when you get injured? The stabilizing muscles, for example, for your hips or lower back, stabilizers are the core. Stabilizers are the extensors of the hips, the external rotators, internal rotators. All those are not activated; they are dead. They basically, for months, they've not been used, and they are not activated. The blood flow is very less in those areas, and that way, increasing the range of motion is one thing. It will increase blood flow through that area, and of course activate to a few degree. But before doing that, we insist on activating it through chaos methods. This is another topic which I'm going to post it in some time. What usually athletes do is they place a band, keep their feet on that, and lie supine on the floor. Place a band and tie it at a certain height, and then they kick the band. Because of that oscillation that happens, there is blood flow. The stabilizers are activated just to keep the body stable, and then probably once you are good with the fundamental movements, with the body getting full range of motion, then you can add chaos methods. You can add stabilizing, you can add bands to the barbell, you can add maybe a single arm squat, just to let the core work, let the stabilizers work, that way. So very important. This is actually one of the most important things that you have to do once you come back from the injury or the rehab. This is the rehab that you're doing once you're back from the injury. And of course, major focus is core, because if the base of your body, the core of your body isn't firing, then of course there's going to be compensation from anywhere. Could be from the lower back, could be from the hips, could be from knees, ankles, lats, shoulder. Everything is connected. Fascia runs from top to down. Okay, so you have to ensure you're firing the core. You're including a lot of anti-tight movements, anti-extension, anti-rotation, anti-lateral flexion, anti-flexion, lots of hip thrusts, lots of lots of holds with the glute bridges, lots of plank variations. So this way you're gonna at least be able to train, at least be able to exercise, and you might also get rid of the pain, because it's nowhere written, I don't know whether your physician has told you or not, it's nowhere written that if you have a disc issue, if you have an injury, you wouldn't be able to walk, wouldn't be able to move. That is what general physicians prescribe. But that is not the case. Okay, I've seen people with injury, with lots of disc issues, still doing great. They're finding ways out. Find your ways out. If you're still, you have a huge lumbar issue, huge arch in the lumbar back, the lower back, and you unable to load the squat, back squat, do something else. Do trap bar deadlifts, or do probably a front squat, or a SS the yoke, the safety bar squat. Could be anything. Just find your ways. Could be sprints. Really good for the lower body. Push-ups. If you cannot bench, do dips. If you cannot deadlift, do pull-ups. It could be anything. Not everything is made for everyone. So I hope you got some value out of it. If you have any questions, please reach out. And please don't think that if you have pain, you don't have to move. Humans are made to move. Okay, because of movement, there are a lot of issues that go away. Because movement is medicine. And if you don't move, there are a lot of issues that you wouldn't even know are going to arise sooner or later. And as you age, you may regret it. So don't go there. Try and move. Start walking. Start doing all this stuff. Start small. Don't get overwhelmed with all this. If you start small, you'll get into the flow, and you'll be fixed for sure. So all the best, and take care.